morning, everyone. We will go ahead and get started. Before I start, Jennifer, did you have a question? I know you have your hand raised. I don't know if you just happened to click the button or if you wanted to ask a question before we got started. Okay. Well, as always, if anyone has any questions, feel free to jump in at any time or put them in the chat. Otherwise, we will go ahead and get started with this month's monthly calls. So we're hosting these today at 11 and then Wednesday at 2. As far as what we'll be covering today, we'll be taking a look at the collaborative-wide meeting agenda as a reminder for everyone, and then going over what to expect for the fall meetings, both for the PCP regional meetings and the specialist clinical champion meetings. We'll talk a little bit about the statin survey that we're planning for this upcoming year. We'll talk about the PCP VBR that's currently on the admin portal for the next VBR cycle that starts on September 1st. We'll share a new document that Jake created, our data FAQ document, and some of the questions that are answered on that, just for everyone's information, and talk a little bit about our upcoming low-carb diet workshop. So as a reminder for everybody, we have our collaborative-wide meeting coming up in exactly a month from now. So that's taking place on Thursday, September 10th. It's going to be from 10 a.m. to 3 p.m. We're having it at the same location that we did last time, which is the meeting space. We felt like parking was simple. It was easy to find the room. I know we had some challenges with the audio last year, kind of cutting in and out. We've spoken with them about that. They've given us some ways to remedy it. So we're hoping that that goes smoother this time. If it doesn't, we won't continue with this venue in the future, but wanted to give it one more chance to see if we could work out some of those issues because we like some other components of it. As a reminder, the PO admin lead or a primary contact and the PO clinical champion is required to attend the collaborative-wide meeting. We do have registration open now through the end of this week. I sent a reminder email last week as well, so just make sure that you and anyone else from your organization that's planning on attending registers by this Friday because we need to get final counts to the venue. And then as a reminder on the agenda, what we'll be doing is having a welcome and updates. And unlike at the regional meetings, these are going to be more administratively focused. So we'll be going over some redesign that we've been doing to the admin portal that we introduced, I think at the June or July PO call. So show some of the final designs on that, talk about the upcoming PO scorecard, talk about the upcoming measurement year in more detail. So like I said, it'll be a little bit more administratively focused than the more clinical ones that we give at the regional meetings. Heidi will be talking about support for CGM implementation as one of the practice level learning community options last year. We invited practices who had a really strong system in place for making sure that the CGM data makes it to the physician prior to the patient's appointment, share how they do it and some best practices. We're going to be analyzing the results of that, sharing some things that we learned, and then talking about next steps. And then we have presenters from Abbott and Dexcom who are going to be talking about integrating CGM results into the EMR and their progress on approaching that with different EMR vendors. So just one caveat, and we'll of course discuss this at the meeting too. Because Abbott and Dexcom can't be certified for CME because of their financial interest, we're going to be moving rooms, just shifting one room over. We essentially have a divider that's dividing the main meeting space into two separate areas. So what CME requires is that we move to a completely different area for any talks that can't be certified for CME. So we're going to do the Abbott and Dexcom presentations as well as lunch in a bit of a different space, and then go back to the main space for the afternoon presentations of the meeting. So we'll get people up and moving, which hopefully will be nice, though I know it's a little bit of an odd setup having to do that. Then when we come back from lunch in the afternoon, we're going to do a recap of the UACR measure. We're close to wrapping up our first year on that. We're going to have both NKFM present. They've been doing some work with one of our participating practices and have been really successful in helping them identify ways to improve their workflow, and we can kind of see that reflected in the data that they've been really successful with that. So we'll have them presenting on how they approach that. This is likely something that will offer going into this next year too. So I definitely invite you to listen and consider if this is something that would benefit your practices too. And then we'll be having some of the POs present on what they did with their practices and within their organization to support improvement on that measure. And then finally, we're going to close the meeting with looking ahead to prediabetes quality improvement. So just as a reminder, we're planning to implement prediabetes patients into the MCTTD patient data dashboard at our final enhancement of the year in December. We already launched our prediabetes website at the regional meetings. We're going to kick this portion of the collaborative-wide meeting off with a patient panel that Heidi's going to be leading, and then we're going to be talking about some of our options and how we are planning ahead to continue offering support in that prediabetes space. So we look forward to seeing everyone there. It should be a really good and productive meeting, and yeah, we will see you all in a month. Please make sure to register yet if you haven't. So moving on to the practice clinical champion meetings, just as an update on these, we have both the endocrinology clinical champion meeting and the nephrology clinical champion meeting scheduled. These should be on the calendars, both of the practice clinical champions, and was sent to the PO clinical or administrative leads as well. So the endocrinology meeting is going to be on November 5th from 5:30 to 7:30. These are virtual, like all of our practice level meetings in the fall are. Calendar invites have been sent, and then what we're going to be doing at the endocrinology meeting this summer, we had each of the practices fill out a survey about how they're approaching dietary counseling with their patients. So we're going to be going over some themes with that, and then accompanying that, we'll have a presentation from our MCTTD dietitian, Rina Hisamatsu, on dietary counseling. We're also having Dr. Andrew Crafson come present as well on some of the weight loss medications, and then we'll have a final update on the CGM interpretation measure as well, since we will have final data for that. So we'll be able to look back and see how the collaborative performed and kind of look ahead to the coming year on the next round of that measure. And then similarly, we have the nephrology clinical champion meeting for Tuesday, November 10th. It's a tiny bit different of a time frame. The endocrinology meeting is the only one of our fall meetings that don't follow that 6 to 8 time frame just because of everyone's availability. So just one thing to be aware of. You should see that on the calendar invite as well. And then at the nephrology clinical champion meetings, we did a survey similar like with the endocrinology clinical champions, though this one focused on cardio kidney metabolic syndrome, and so we're going to be reviewing like what we learned about that. We'll have a final update on the nephrology UACR measure, and then we'll likely have an additional topic or two for the nephrology meeting. As part of the survey that we distributed, we asked them what they wanted to make sure was covered at that, so we'll be looking at those responses and picking another topic to add to the schedule for that as well. And then registration isn't required for these. They're a little bit smaller meetings, so they're a little less unwieldy to kind of track who's coming or not. So we've just sent the meeting invites to everyone that's required to attend those at the practice level. For the POs, your attendance is optional. You're, of course, welcome to be there, but the only thing that we're tracking and giving credit for is the practice clinical champions being there. And then the fall regional meetings, similar to last year, we'll be offering these twice, and we've split the regions up into 2 meetings, between one on Thursday, October 22nd, one on Wednesday, November 11th. These will be taking place from 6 p.m. to 8 p.m. like all of our PCP regional meetings do. And like with others, if someone can't attend the one that they were assigned to because they're going to be out of town or have a conflict that evening, they're welcome to attend the other one. The content will be the same. We just were trying to keep these equally distributed to the extent that we could. We are going to have registration open in early September so that you can make sure that the right people are planning to attend this and follow up with everyone to make sure that they know what's happening. And so we'll have that shared soon. And then for our agenda for the meeting, we're going to be doing MCTTD updates. Like I mentioned with the collaborative wide meeting one, these are going to be a little bit different. They'll be more clinically focused like they typically are. So if there's new medications coming out that we want the practices to be aware of, changes to coverage, etc., we'll cover all that in the beginning updates. We're going to have NKFM present again, so this will be a similar discussion to what's happened, the presentation they'll give at the collaborative wide meeting. What will be different is that the practice that they worked with, Prism Health, will be able to join this one as well and co-present with them, so they'll be able to give that practice perspective. And again, this will be a great opportunity for your practices to think about if it's something that may be beneficial to them as we enter like the next year of this UACR measure, and consider if they want to work with NKFM. The support they offer is free. They've done like a site visit like to the practice that they were working with, so it's a really good opportunity and really good quality improvement support. So you'll learn more about that both at the collaborative wide meeting and at the regional meetings as well. We're also going to spend some time going over in depth the 2026 to 2027 VBR year for PCPs, as well as like any changes to performance measures. Feedback we've gotten from the previous meetings is that they do want to go over this administrative information, make sure that they have a good handle on it. So we'll spend some time at the meeting doing that so that they all know what their expectations are. We'll be able to go over things like the, time frame changing to a calendar year measurement and us narrowing the performance measure population, all of those kind of details so that the practice clinical champions are all aware. And then we'll have two kind of mini short presentations from 7:30 to 7:45 and then from 7:45 to 8. We're going to cover the Medicare Bridge program, which we sent out a very detailed email about back in July right as it kicked off on July 1st, about how to order for that, how to operationalize it, answers to questions that patients may have. So we'll be doing a brief update on that and answering any questions that practices have. And then in that final portion, we'll be talking a bit about statins and type 2 diabetes. We just want to keep this on our agenda as we prep for this next year to potentially launch this as a future performance measure and continue to kind of touch in on that and give some updates. So related to that, as we've discussed both at these meetings, at the spring regional meetings, what our next steps are related to potentially looking at statins as a measure include a couple of things. Like we talked about, we are updating the dashboard to reflect like a 12-month time period, reflect more what this would look like at a performance measure, and then we'll be sending out reporting to the practices on it ahead of measuring it or setting any targets, just so that practices are getting more used to seeing that data, know how they're performing before we launch it as a measure. And then the other component of this was to do a patient level survey around statin use, and we're going to use the results of this survey to create kind of a driver diagram on where patients are and why they aren't taking statins if they aren't, and to inform the tools and resources that we create to support your practices when we do launch this as a performance measure. So as you'll see in a couple slides, this is a component of this next year's VBR scorecard, is going to be getting responses on this survey. So we have our survey drafted. We had the patient advisory board test it out. So we had some members of the patient advisory board take it, time themselves, give us feedback. We've incorporated that feedback so that it's hopefully very easy to understand for patients, not too taxing to complete. And now it's been sent to the IRB for review so that we are all set from a regulatory standpoint. And then the requirement in the scorecard is that each practice has 5 patients who are not on a statin complete this survey. So we're wanting to hear from patients who aren't taking one so that we can understand their reasons, rationale, thoughts behind that. We'll share the survey out with the link so that you all can review it and see it and just be aware of what's being asked. We also have created a flyer like we've done in the past when we've collected patient surveys that your practices can print off and use to distribute it to patients. It'll have a QR code, it'll have a link, and similar to what we've done in the past, if there's a patient who can't complete the survey online and needs a mailed copy or needs telephone support, we'll have a form that the practice can complete to request that we reach out to that specific patient. So we did that with the new practices that joined in 2024 where we did a patient needs assessment survey. It worked out really well. So we're planning to do that again. And then we'll be compensating patients $15 for completing that survey. MCTTD completely handles that portion of it, and the patients will get mailed a check once they complete it. We're going to have this available for the practices on September 1st, and then we will be requesting those 5 responses by December 15th. That gives us plenty of time to analyze the survey, make a plan, and share out like a well-formed plan at the regional meetings around like the education that we're going to create related to the results and what we plan to do as next steps. And then throughout this process from September to December, we'll be having tracking on the admin portal, again, similar to how we've done in survey distribution in the past, so that both you and your practices can see, okay, we've got 3 of 5 surveys submitted. We'll just need to complete, like, get a couple more done by December, etc. So you'll be able to look at any point and know where you are with this and when the practices can stop handing out these flyers and have met their requirement. All right, and then just briefly wanted to walk through the next PCP VBR scorecard. So the next year for this begins on September 1st, 2026, and all of ours are retrospective now. So this is what they'll be paid out on beginning 9/1/2027. So I have both the scorecard that's included on the portal right now, and then a final slide that talks about like any of the differences between it. So I will walk through this, and I'll try to also just highlight the differences as I go through this too, but leave the slide in here so that you can reference it later as far as what changed. So as far as the regional meetings, you'll see that the regional meetings are, of course, still a component of this scorecard. However, one thing that we've done that I hope will reduce a lot of confusion is previously we had attending the regional meetings together as one single measure. So it wasn't always clear if someone only got partial points or if the spring ones weren't included yet, but then they weren't seeing points for the one they had attended in the fall because we only waited until both were done. So there's a lot of questions and confusion that created. So for this year, we separated them out into 2 separate measures. So it's very clear whether points were rewarded for the fall or whether they got partial points, etc., without having to wait for the spring meeting to occur. So the number of points attributed to each is still the same, but they're now just 2 separate measures so that it's simpler to track and to know when those points have been assigned. So those are the first 2, attending the virtual meeting and then attending the spring regional meeting in person. Another thing that we'll be doing this year that's similar to a requirement that we had last year, but of course changing as far as like what we need to know and ask about as a collaborative. So last year on the scorecard, we asked practices to complete a census survey, and we asked them things about like information on the practice, like their EMR, their patient insurance distribution, their clinical staffing, the quality improvement support that they had at the practice, etc. This year we'll have another survey component of the scorecard, but it's going to be related to reflections on like changes made to UACR workflows during the previous year. What we're hoping to do with this is to be able to look at improvement on UACR screening rates and see if we can tie it back to specific process changes that practices made that were especially successful. So this will, similar to the census survey, be relatively short. It will probably take around 10 minutes to complete. We're asking for 1 per practice, and then, like I mentioned, we'll probably bump that up against the data for the performance measure and see if we can see any patterns or learn anything from the changes made and how they performed on it. And then Measure 4 will look very, very similar to the past around just meeting the physician level learning community requirement. That has remained the same, where it's not every single physician has to do it, but we have different tiers of points related to the percentage of physicians in a practice that complete it. And then next you'll see the practice level learning community requirement, that again, similar to what we've done on previous years. The only one thing I want to call out as a small change, and I know this date has fluctuated in the past too, but Blue Cross Blue Shield has kind of moved up their timeline on when they want us to get them the full list of physicians that should be earning VBR and the percentage that they have. So they have through the end of the middle of June to complete it instead of the beginning of July, just so that we can get that data to Blue Cross. So just have a 2-week earlier time frame for completion on that. And then a new measure entirely is the one that I was just discussing around the patient surveys on statin use. So we have different tiers of points based on the number of surveys that they're able to get submitted, with all of the points being assigned if a practice is able to submit 5 surveys by that deadline in December. And then the only performance measure due to the change in timeline to that calendar year 1/1/27 to 12/31/2027 for our measures is the UACR measure that they are currently working on. So this is the one that began last July and then is ending at the end of this month. We're going to be getting the final scores at the end of October. And so this will be one of the earlier updated items on the scorecard. So this is a little bit different from when A1C was the measure, and it was one of the last things that we updated because we got in those numbers right as the scorecard was due. So you'll be able to know how many points your practice has gotten on this by 1/1/2027 at the latest, and that's like with us building in time to make any needed adjustments to the UACR scores. We'll talk a little bit more about that later as well. And then we have different tiers based on the level of improvement that they've met. And then finally, the last one is a component that we're keeping from last year's scorecard where practices are able to earn bonus points based on completing the practice level learning community requirement and the physician level learning community requirement by sort of the halfway point of the performance year. We're hoping that this would reduce that kind of last minute rush to finish it all at the end of June. And we did have a good number of practices doing this last year. About 70 practices were able to complete it. So hopefully you felt the burden of some less questions at the end of the year. I think it was a little bit better this year for that. It kind of just splits them up, so you're getting some in December instead of June, but still kind of nice to have that distributed out a little bit more. So we'll plan to continue doing that for this scorecard as well. And then all of the changes that I just talked through as we went through the scorecards are listed on this slide, just so that you can reference this if you're looking at the slides later and don't want to listen to the full recording. So I won't go over this slide in any more detail, but those are kind of just what I talked through as far as what was on the previous scorecard and what's changed on this current scorecard. And then the other thing that you can currently see on the portal right now, though ultimately this is going to look a little different. Like I mentioned, we're going through a portal redesign process that we're kind of doing iteratively. So it will be somewhat like Dashboard 2.0, where it doesn't all change at once, but we're changing like different aspects of the admin portal to be a little more user friendly and a little more graphically designed than kind of the more bare-bones structure that we started out with. So as of right now, this is how the PCP tasks are included on the admin portal. They're all listed now. The ones from the previous year have been removed since that VBR year is done. And this is, of course, the overall view. Yours will be like tailored to the number of practices and physicians that you have participating. And then any that have like attended learning community events in July or August, you can already see that some providers have already met their physician level 1 for this next year. We've also updated the more info tabs on all of these to give a brief description of the requirements, especially the new ones that we just added around the UACR survey and the responses on that. Blair, you asked when this will go live for PCPs. We can have it go live soon. I just don't want it to create confusion around if they need to do things now. We tend to have it start like with the new VBR year, so right around the beginning of September, just so that they know like, okay, these requirements are beginning now. Okay. And then just covering a few other things briefly. So we've been offering our low carb diet workshop twice a year. Rena's been leading this. We've been doing one in May that's like a little more beginner level. It's a 5-day one. It's kind of starting with the basics. And then in the fall, we've been doing a slightly more advanced version of the low carb diet workshop that's a little bit shorter and goes into some more complex topics. So we have this scheduled again. It's going to be taking place Wednesday, Thursday, and Friday, October 28th through 30th. It's going to be 9 to 10 in the morning and then 3 hours total across those 3 days. This workshop is going to be best for any dietitians that are in the practice, but clinicians who feel like they have a pretty good grasp on low carb diet counseling and want to do it at like potentially a deeper level might also benefit from this too. So we distributed an email last week with interest forms due on September 1st. We, in that email, covered like the specific details of each of the sessions so that hopefully anyone who's considering it can see if it's a good fit for them and if it will kind of meet their needs. We don't recommend that people who have already taken the workshop take this because a lot of it will be review and then like building upon that, but we didn't feel like it was enough like new material to like warrant attending again. But then similar to in the past, any dietitian that attends this, their practice will earn practice level learning community credit, or if anyone else from the practice does, and then any physicians will earn both physician level credit and practice level credit for their participation in this. And then just some brief data dashboard updates. So on July 29th, the patient data dashboard was updated with data through May 31st. We're also working on performance reports that will be shared this month that have like the current rates of performance. This May 31st is significant because that is the beginning of the lock period for the PCP UACR measure, the nephrology UACR measure, and the CGM interpretation measure for endocrinologists. Patients can still leave the denominator, but no new patients can enter the denominator, and that's for like the last 3 months of the performance year. So what you can expect for data updates going forward, we'll have another one on September 30th that's going to bring the data through the end of July. And then the final update for this performance period, that will be at the end of October, and that's going to bring data through that 8/31/2026, which is the final end date of these performance measures. And then we know that there's been some challenges with the rates on the UACR measure. We've had a lot of POs and practices like being concerned about the denominator increasing. So just wanted to address some things with that, and then Gina, I'll get to your question in the chat. So one thing that we're looking at now is we've noticed, of course, and as have many of you, that there's been large increases in the attributed patients throughout the performance year. And looking at this, we think it's related to one of the criteria that we have for the denominator inclusion. So we're looking at patients who have had at least one claim since the beginning of the baseline period, which was 1/1/2024, and then the population lock date. So that like increases, and by the end of the measurement year, it's encompassing really 2 years and 5 months of data, which is a very long time, and may have some patients that might not necessarily need to be included in the denominator. So what we're going to be doing in the future is we're right now looking at evaluating what a rolling inclusion criteria for claims look like. So instead of it being 2 years and 5 months and including that entire baseline period, we're looking at it having be like a rolling 12 months at any given point during the measurement period instead of that 2.5 years, which we think should really reduce the number of patients that increases by. Now for this year, of course, we're looking at the scores. And we've talked about with some of this with you one-on-one, and Gina, like to your question too about like if there's issues with the denominator. One of the things that we're planning to do overall before like kind of taking an individual look at performance and who should be included and who shouldn't is we're planning at the end of the measurement year to retroactively apply the performance population that we're planning to apply for future measures, which is that 2 diabetes diagnoses in the previous 2 years. So right now the denominator is a little bit broader than that, and it includes anyone brought into our dashboard by like any of the criteria. As a first step in like analyzing performance and limiting the denominator from what it is now, we're going to plan to apply that. We're doing a test of that this month to see how much that's impacting the scoring, and then we'll see where we are from there. If that kind of reduces the denominator to a point that it's a lot smaller, everyone's doing well, we're sure those patients have type 2 diabetes, that may be the only thing that we need to do, and then we can kind of do individual practice back and forth and looking at like any issues that might need to be resolved. And then Gina, to your question, feel free to reach out to us first just to explain a little bit more about some of the attribution issues, and then we can decide if it makes sense to escalate it to MDC or not. So if you want to shoot Jake and me an email, that would be great. And then finally, and I know we're at time, so I'll wrap these up really quickly. We've created a document, the Patient Data Dashboard FAQ, that Jake has developed based on a lot of the questions that we've gotten, since they do tend to follow like a typical pattern. We know the patient data dashboards and the performance measures are a lot of information. They can be confusing. So we wanted to have this reference point, and we're going to post it on the admin portal under PO resources for you. This is a list of all the questions that are currently addressed in the FAQ. So things that you may be wondering about like the performance criteria, patients without type 2 diabetes in the denominator, why is the denominator increased, why are there duplicate patients, etc. All of these are addressed in the FAQ, and then we'll keep building on this FAQ as well as we continue to get more questions that we're really hearing a lot from people, so that hopefully this is a good first starting point as a resource for you to kind of understand like some of these different components of it. So we will get that posted and shared shortly and continue to build off this as we get more questions. And then finally, the last thing I wanted to let everyone know about, we have our next learning community event on Friday, August 21st. Rena's going to be leading it, and it's going to be a stepwise approach to low-carb diet counseling. So what you kind of can do at a first appointment with a few minutes, and then, you know, if you have more time, building on that, etc. But it's kind of talking about what you can do in like different time frames, different intervals, and at like different appointments with patients. So hopefully it's going to be very practical and like easy to apply. And then, as a quick reminder, we don't have any PO calls next month because we have our collaborative wide meeting taking place. And as of right now, we'll tentatively plan to reconvene in October based on the topics that we have. Again, we have regional meetings beginning in October too, so we may ultimately decide to cancel these as well. But as of right now, these are our next scheduled dates.